Hi, this is Al Hutton with Indoff from the ahutton.com site. What this is this is a quick introduction to our dry erase TV set for patient rooms in hospitals. What we've done basically is taken a standard LCD TV, it can be any size, 32 inch, 37, 42, whatever you'd like, and we've made it dry erase. We've done this with our chemical resistant DA plus film, which we overlay to the surface just like you put on window tinting. Once you've done that, you have a perfect dry erase surface. This image here is just a generic image, which if you wanted a simple board with no data and no changing, you could put up a board just like this one day and you could put up a different image the next day. What we're doing here is we're basically applying a USB thumb drive input to the board so that you can take the image that we generate on a PC, stick it on the board, and change it as much as you'd like or as little as you like. Let me give you a quick example of how we do that. We've made up a custom add-on to Vizio, which allows you to set up a board. What we've done here is, instead of taking different areas in the hospital like labor and delivery and geriatrics or joint replacement, we've just concentrated this batch of boards on women's services. So we've set up a basic layout for a women's services board that takes into account AntiPartum, postpartum, and so forth, and you'll see how we do that in a second. We basically have a couple areas that are fixed images that are the same all the time, such as this area. And then right here we have a little box that says image 2. With our database part of the Vizio program, and this is a Vizio screen right here from a PC, we can put a multitude of image 2s in this box. We can also do image 4, we can do image 1, image 3, we can have as many images as you'd like, and they can either be there or not be there. We've done the same thing with text. Right here we have a nice title block in large font, which we can change to be an AntiPartum or a postpartum board. We have an area over here where we have a room, a telephone number, and a patient name. That's text that can be inputted. If we have a baby's name, we can put that in. If we have a time of birth and a weight of birth, we can put that in. And again, those don't have to be in on a board. Obviously, you're not going to have time of birth on an AntiPartum board, but on a postpartum board. And our database allows you to do that. Let me just give you a quick picture of what our database looks like. This is the database we have set up in Vizio for this little batch of boards, and it could be 50 rooms, 100 rooms, or it could just be 6 rooms. We put in text in a little text box, sort of like a little Excel file, where we put the room, the telephone number, the title of the board. Then we can also do specific text, like the time of birth. Over here we have the weight at birth. Over here we have the patient's name. And here we have the name of the baby. And again, these can be used or not used depending on how much you want on the board. Here are images. You see the word none. That means that no image will go in this spot for image 1. Here where image 2 is, we're using basically 5 different images or 6 different images, which show the whole range of boards we're working at in this area. So again, we're just trying to give a quick overview here to show what's going on. If we go back to the first board, which is the AntiPartum board, you can see here we have the title up at the top. We have this image filled in. We have this image filled in where we have an estimated due date. And the image can also be words along with an image. So this whole box is actually an image that fills in this box. Over here, we don't know whether it's a boy or a girl yet, so we've left that as it should be. Now, if we go to postpartum, you have a whole different case now where you do know whether it's a boy or a girl. You've probably named it, and it has a delivery time and a weight. Now once this is put on the board, the beauty of this is you can still use your intakes and outputs and fill those in as normal, but when you clean the whole board, the delivery time, the patient name, Ethel, the baby's name, all that type of stuff can stay on the board. It doesn't have to be inputted again. So while it takes a little bit of time to input the information and transfer it with the thumb drive over to the screen, you do save time by not having to remember what the details are that are in your little database. Here we have an example of what you would do for fetal demise. You'd basically take out all reference to a baby, and you could have other things down here, but basically what you're trying to do is get rid of any references to a baby and make it a nice simple board that will make the patient's experience a lot better than looking at birth weight, baby weight, all those kinds of things. And this way you can use the same room and the same board basically for multiple situations. Here we have go to women's services, and this could be just a generic board where it could be set up for hysterectomies or anything else, or it could be more specific. Again, it can be any way you want it. Here we show an example of using a board for Spanish. If you have limited use for Spanish and you want it, sometimes we can make you one layout where the whole board is just in Spanish. All these words could be changed to the Spanish box, and everything could be in Spanish, and that allows you to keep your board in general uncluttered in English, and then when you need Spanish, use it. There's also the ability, as you can see here, where we put an image of a nurse in. If you would like to have 4 nurses, one for each shift, or 3 nurses on the board with their pictures, that would be a fantastic way to customize the board for that room or that wing or that floor. And if it's for a whole floor, you could have different nurses on each board. Very easy to do just by putting them in the image box in the database. Here we have an example of a labor and delivery board where we've added a whole dilation chart to the board. This allows you to customize your board for the time of the patient's stay and really make them think that you're spending the extra time on them and trying to make their whole experience the best. Again, this goes back to the database, shows the data that we put in to make that range of boards. And again, you can always go back to something nice and simple with no input and just have that as your default board. So if you run out of time, you're busy, your computer has a problem, just go back to a generic board and boom, you're there. So we think this is the way to go in boards. As you may well know, we make more custom printed dry erase boards than anybody, but electronics are getting cheaper and cheaper. People want more and more customization. We think that this is a nice way to get into a low-cost custom board with minimal investment. The TV is the biggest part of the investment. You don't need your IT department involved. It can be done on one floor with 5 rooms, would make it a practical situation. And we do the templates for you. We sell you the templates, and boom, you make your board just going back to this database. Bring them over with a thumb drive onto the TV set, and you have a fully customized board that's just what Ethel needs, or baby Ethel needs, for Matilda the mother. And we'd love to talk to you about this, maybe work out a demo with your hospital, because we're in the prototype stage on this, but we think we're very close to having a working unit. In fact, we know we have a working unit. We just need some more testing and make it easier to use. So if this has any interest to you at all, give Al Hutton a call at ahutton.com, 860-632-2026, extension 111 and ask us about our TV hospital boards. Thank you.